A very good evening to you, our esteemed viewer. We want to thank God for you who is watching us here on Church of Uganda Family TV. The program you're watching is Health Port. Health Port is a program centered around maternal and child health, early childhood development, and other public health concerns. Now, this program is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. Why? Because your life, your health is our priority. My name is Edrine Mukalazi, and I'm delighted to introduce today's topic. But before the topic, it is important for us to know our guest, and he is none other than the one Kato Husseinilee. They tell us Abalongo have no title, so I can't call you Mr. Kato. Kato Hussein, you're most welcome to this show.
Thank you very much.
Yeah.
I'm Kato Hussein, as you've introduced me.
Yeah.
I'm very delighted to be here to share with you about health.
Indeed, and we are excitedly waiting to hear from you, especially when it comes to self-medication. Why? Very many of us are addicted to self-medication. We have become our own doctors. We prescribe. The doctor tells you take 2 times 3 and you start to take 4 times 2. You know, a lot of things when it comes to self-medication. And that is why I say we are really excited about this topic, because it is an enriching topic. So just to get into the discussion, if we can break down the term self-medication, how can you break it down to someone who is watching us in a layman's language?
Okay, thank you very much. As I've said, I'm Kato Hussein.
Yes.
Allow me to say that self-medication simply means that an individual is going to go to the pharmacy, is going to go to where they sell drugs and buy those drugs and use them on something, a symptom or a sign that he or she has felt, what we call self-diagnosis. So ideally, in a layman's language, it means someone is going to go to the pharmacy, you buy a drug on what you think is the disease and which is not confirmed by a medic. So simply it means that.
Okay.
Yes.
And when you talk about self-diagnosis, this is very common. Very many of us, you have some headache or you have some fever, and you say, according to this science, this is malaria. So you go sometimes and buy the medicines, like you've said, and then we have what we call first aid.
Yes.
But also we have what we call emergency response. And so we tend to confuse the two. Sometimes we think what we are doing is first aid, yet it is self-medication. Or we think what we are doing is really responding to an emergency, yet in actual sense it is self-medication. Let us discuss about the two and how different they are and how they are separate from self-medication.
Okay, thank you very much. When we talk about first aid, in a layman's language, it means it is the first help we give to someone who has got an accident or who has got an injury. But with an intention that immediately after giving it, this person is going to get full treatment.
Wait, a first aid is not intended to end there.
No. First aid, it means that someone we are giving partially to prepare this person for a full treatment. So if someone gets first aid can become self-medication. How? If someone has been given first aid, for example, maybe someone was having high temperature, I was having fever, then we give paracetamol, which is a painkiller. Definitely it will lower the what? It will lower the temperature. But at the end of the day, this person was supposed to go to a qualified medical personnel for further treatment, full treatment. But this person ends there. When that person ends there, it becomes self-medication.
Okay.
Why? Because this person is under sitting a problem he or she does not understand. Yes. Then when we talk about emergency treatment, emergency treatment is the help that we give in cases where we have life-threatening conditions. For example, someone has come to the emergency ward and is having severe bleeding. We use emergency drugs. For example, when we are using these emergency drugs, we intend that immediately after giving these emergency drugs, we are going to concentrate fully to give the attention to the patient until we discharge this patient. But the problem comes that some people, what we do, we get what we call first aid, and when we stop there, it becomes self-medication. And these two things, self-medication and emergency treatment, at times they are being confused.
Yeah.
Because first aid can be given from home, can be given at the workplace, and can be given at the hospital. Then emergency treatment or emergency response cannot be given elsewhere apart from the hospital. So when we say emergency management of the patient, we are managing that patient from the hospital setup, not from anywhere. So if we are helping or we are giving support, life-threatening condition to a patient who is not within the hospital, that person we are giving first aid.
Okay.
Yes.
And who is supposed to give a first aid? Anyone, or I can go to a nearby clinic, or and then at least a nurse there offers the first aid.
The issue of first aid is a very big story. Okay. It is a very big story. What I can say in brief is that first aid can be given by anyone, provided that that person is having someone who is nearby to give the professional part of first aid. For example, I may find someone is on the way, has been knocked by the vehicle. The first incident I have to do is to remove this person from the site, from the danger scene, to put this person aside. But I may not go deep to an extent of putting on tourniquets. We need someone who knows how to do it. Actually, a first aider is a person who is qualified to give first aid. Not everyone can give first aid. But what we can do, we can help in places whereby we need to prepare this patient for first aid. Okay. Then the first aid has got a lot of obligations, has got a lot of responsibilities. Okay. Because in the medical profession, we have what's called the Samaritan law. The Samaritan law, it is whereby someone has given first aid, but the question comes, who are you who has given it? That's why we see some circumstances, people are being knocked on the road and people run away instead of giving first aid. The question of who are you comes in. You are giving first aid as who. You need to be with the who part so that you give the what? The first aid. But my emphasis and my message to the public is that let us give first aid in the first place, whereby we see someone is in need. Let's not leave these people. The who comes whereby we have to help this person to meet the medical personnel who is qualified to give the better part of it. Okay. Not to leave the patient or leave someone there to die because you are not a qualified medical personnel.
And even the people who receive first aid, they need advice that when you get first aid, that is not full medication. You need to seek for further medical intervention. And now we talk about the factors that, what are some of the factors that may make people really go for self-medication? One, some of us are accused the clinicians or the medical practitioners. Someone has a clinic, someone comes and says, "Yagala yokowatem."
Yes.
So they'll count the tablets that are within that, and then they give you that. No follow-up, no diagnosis, no what, and you don't even know the history of this patient. But because they want that, and you also need the money, you give them. But what are the factors that prompt people to self-medicate?
Actually, there are actually two major factors. The first thing in the medical profession, we have what called the patient's rights. The patient's rights, a patient has a right to choose the right medication, by who, from where.
Pardon?
We have what called the patient's rights.
Yes.
The patient's rights is where a patient has a right to choose to accept any kind of medication, to by who, from where. Now these three things, they become a core of self-medication. Whereby someone, for example, like me, Kato,
yes.
A friend sick, I need treatment. Now, this person, to answer these three questions, at times, in most cases, they may sum up to these questions and end up doing self-medication. Where is going to get the service, by who, and what type of treatment. For example, someone might be having maybe headache, abdominal pain, running stomach, and maybe feeling dizziness. And this person may anticipate is having malaria.
Yes.
Now, in anticipating that this person is having malaria and knows that the treatment of malaria is coartem, forgetting that the kind of malaria this person might be having might not need the coartem. Maybe we may need the IVs, the intravenous treatment part of it, where we are going to give artesunate. Now, this patient rushes to the drug shop and tells any medical person he finds in there that I need coartem. When this person takes this coartem, it might be also true that this person has took coartem, which has no effect to the disease or the condition someone is having. And remember, with the drugs, we have the side effect part of the drug. Now, if you take a drug and you're not sick, we expect you to get the side effects of the drug.
Yes.
And then another thing why people decided to go with self-medication, people undermine the diseases, the conditions they get. Someone, maybe in most cases like the men, self-medication is very common among us, the men. Because someone has been driving from Chisolo to Kampala, has been using Glocobom, has been doing ABCD, but feels a lot of dizziness, feels the stomach upset, and so on and so forth. And the only thing these people give is that these cases are minor. They undermine. Now, in the due course of undermining that, the disease may not have an impact, a serious impact. Someone chooses to self-diagnose. I feel headache, I feel this is malaria. Because when I'm going to get malaria, I feel ABCD. But forgetting that the symptoms someone is presenting, those symptoms might be the same symptoms with another disease. In the medical field, we call it differential diagnosis. The differential diagnosis whereby we have two similar symptoms
for different diseases.
For the different diseases, and they are the same. But we look at the cardinal signs. That we see that if it is disease A and B, there is a cardinal sign. Now,
which a layman may not
figure out.
Okay.
Now, in the due course of not able to figure out, someone ends up doing self-medication because someone mastered that if I have ABCD, definitely I'm suffering from this.
Okay.
So another factor is the distance between the health workers and the people. It is a matter of public concern.
Yeah, true.
Because some of us, we are born from deep in the villages. For your information, me, I'm born from Chibale. Deep there in the villages, in the middle part of Uganda, the western part of the country. But our people there, not everyone is able to access the health services. Someone may not be able to meet the doctor, to meet the nurse, the midwife, and so on and so forth. Now, these people, what they do, they stock drugs. They go and buy in advance. Now, in buying in advance, these people...
And in bulk.
Forgetting that in any drug that we consume, we must be very certain of its expiry date. We must be in the position to store it properly. We must be able to take it through the right route and the right dosage. So these people, they end up misusing these drugs because there is a very big gap between the health workers, the health facilities, and the people.
And I think this is really a very big concern. Well, we are taking a short commercial break, and when we return, we shall continue with self-medication and its effects, especially you who is addicted or who is a practitioner of self-medication. Welcome back from that commercial break. This is HealthPort. HealthPort is brought to you by Makerere University School of Public Health, and it is centered around three things, that is maternal and child health, early childhood development, and other public health concerns. Now, this is a critical public health concern that we are discussing today, that is self-medication. And you realize very many people practice self-medication partly because they are not aware that what they are doing is really self-medication, or others know that what they are doing is self-medication and it is wrong, but they choose to continue practicing it without knowing what danger it has to their health. Well, before the break, we are still looking at the factors that prompt people to to self-medicate themselves. And if we can continue with the factors before we can go to really the dangers and effects.
As we've been saying that
Yes.
the factors we have, one, people undermine
Yes.
the signs and symptoms they get, then the distance between the health workers or the hospitals and the patients. Then another factor that is very common, there are many people, actually this one people may not give it attention, but the fact is that most of us, when we are still young, we wanted to become doctors.
Exactly.
And some of us, we wanted to become medics. And it is a heart desire to us.
Yeah.
Now, in most cases, these people, they do tend to feel that
by practicing it on themselves.
By doing it on themselves.
Now I no longer have an opportunity. Let me do it on myself.
Actually, in psychology, we usually call it substitution. If I don't get A, let me substitute it with B. At least I feel the pleasure of it. Now, in most cases, some patients, they do that because I have a scenario. I had my wife is a medic. I was at home then. One of the patients she worked upon from the hospital came at home. But in coming at home, she had come to seek medical advice on the management of a certain condition. But rather, the one who came to seek advice, talked more than even the one whom she had come to seek advice. But what brought about that, we came to realize that she has that desire. She had that desire to become one. At the end of the day, when we do this, we usually end up doing self-medication. Because what you should know in the natural setup, every mother is regarded as a medic.
Yeah.
Every mother who has got children.
Yeah.
Every parent is regarded as a medic. Because you should
they can
remember
even
that
advise
during the days we were born, our parents could even stop drugs.
Yeah.
They could even be knowing the basic drugs to give.
True.
But these days I don't see that. People, they are just going on Google to look
Exactly.
at what someone is having. This could be the possible signs. Then someone orders for the drugs. You also have this system of people, they are ordering drugs online.
Yeah.
Online drugs.
And very many pharmacies do that.
People, they are...
Don't bother yourself. Order, we deliver.
Yes, they are doing that, but we say it is good. We are extending service to the people. But we should be very conscious that before we give these drugs to the people, we need to look at the prescription from a medic who has prescribed those drugs. Yes, I will make an order online. I'm going to get the drugs. However, another factor as why some people, they are misusing the drugs, we have what we call over-the-counter drugs. Over-the-counter drugs, these are the drugs whereby they does not need the doctor to prescribe them. You readily get them when you go to the pharmacy. You will get them. But there are some drugs which cannot be given to the patients despite writing for them and prescribed for them unless it is given to a medic. Those drugs, they are controlled. The drugs that are being controlled, these are the drugs which can cause an effect of addiction to the patients. Now, it is very true that most of the drugs that are given over the counter, they are the most misused drugs. And the people who are within those pharmacies, I want to appeal to them, their fellow medics, because by the virtue that we are health workers, we are supposed to be there to save lives. Despite that we want to make the money, the monetary part of it, but it is secondary to the calling that we have. So I want to appeal to my fellow medics over out there that before we give out these drugs to the patient, let us strictly look at the prescription because it is mandatory upon us. Then the lastly, another thing as why some people, they are doing self-medication. Self-medication is also brought about by the people who think that the going to the hospital, it is wastage of time and money and resources. Yeah. There are some facilities, for your own information, Mr. Edrine, is that some people, to offer your service, you must pay consultation.
Exactly.
Before even you see the doctor.
Yes.
I feel a headache, I feel abdominal upset, but you are going to pay consultation of 10,000 or 20. Before even you reach to the physician. When you reach the clinician, we just prescribe right away, then you go. Someone to look at that sees as if it is wastage of time.
Their money has been...
My appeal to my fellow medics and people outside there is that please let us go to the qualified medical personnel in the hospitals where we are supposed to get in the clinics where we're supposed to get the treatment. Reason being, it is not wastage of time. We spend a lot of time in medical institutions purposely because of this. Because me, I was wondering, why does it take 11 semesters, 5 years, 7 years for someone to qualify to work upon someone? It is because these people, they are very tentative. It is a do or die, whereby we need to be very critical enough so that we can create a difference. I want to appeal to each and everyone that the health services that we get, they must be within our yardstick. We must be in a position to go to, if I know that my economic status is not good, there's no need, that's why I should go to first class
facility.
A facility. I may not mention the name, but it is very important to be within your means, because where you are going to go, there are people who are qualified to give you the treatment that you need. Then lastly, about self-medication, there are some people who undermine in the public. I know the viewers there's someone also says, I may not go there to this clinic here because there's ABCD.
We've also named some facilities as Abotebajjanja, Oyawonya, Oyutawonya,
Oyomwana Muto, and so on and so forth. But I want to appeal to the public that someone to qualify to be where you are seeing that person, the small clinic that you are seeing today, that person qualified to be there. And the person you are seeing there must have worked within the different bigger hospitals where you are going during the school practice. So even if you find someone deep in Kanungu in the clinic, unless if that person is not qualified, but if that person is licensed and qualified, please adhere, because has been trusted with your life. That's what the government has done. So I want to really call upon the public to be vigilant about self-medication. It is very dangerous.
And talking about that, let us look at some of the danger effects that self-medication has, especially to people who practice it ignorantly.
Thank you very much. Actually, self-medication is very dangerous. Actually, I may term it as self-murder. Because what we are going to discuss about, it is equivalent to someone committing suicide. Ignorantly, knowingly, or because of any other factor. In the drugs that we do use, the drugs have got the good component, the effect, and they have got what you call the drug effects. The drug effects, they are the undesired results that we get. But the effects that we desire to get, usually, we give a drug anticipating, very well sure that this drug is going to do ABCD. But if someone takes a drug without prescription, that person has committed suicide because of the following reasons. One, it brings about delayed treatment. If someone does self-medication, it causes someone to delay to get the right treatment. First of all, the diseases that we get, we need to respond to them timely. For example, if they diagnose someone to have cancer, you need to act there and then. Because if you delay, it will spread over. Now, another thing that we usually see that during self-medication, someone may not know the right route. When we talk about the route of administration, there are some drugs which we cannot give through the veins. There are some drugs which we cannot swallow. There are some drugs which cannot give by injection. For example, we have tablets. Those ones we swallow them. That is the route. Oral. Then we have injections. We put them on the buttocks. We inject. That is the route. But if we say that the drug which was supposed to be injected on the buttocks, let us give it through the veins, someone will die there and then. Another thing, the route, when we talk about the routes, also look at people, they are misusing this. Allow me also to clarify on this. Yes. When you go to the pharmacy and they give you drugs which are capsules, not tablets, capsules, when they are packed within the capsule, you are supposed to swallow them while they are in the capsule. Don't remove them. Why? Because These drugs, you are going to swallow them and go to the site where we want them to go. It is where it is going to act. But if someone removes the capsule and swallows because thinking it will have a major effect and faster relief, you will end up damaging the route where it is passing. These people they knew that their tablets will have to swallow and those ones which have to be enclosed and go exactly where it has to cause an effect. And I think that it is another problem that we see, we give wrong dosages. When we are giving any drug, we must know its dose, its strength. Does it match how many milligrams, how many mils, for how long? Because in any kind of treatment, we must clearly state this. It is very important to know that the most misused drugs, they are children. Because a mother goes to the pharmacy, buys syrup because the baby has been coughing for 3 to 4 days.
And maybe the neighbor used the same, or so and so recommended it.
Yes. So at the end of the day, you find that maybe an infant is supposed to take 2.5 milligrams for 3 days, and the mother is going to give 5. Or someone is supposed to get 10, is an adult, ends up getting 5, which is underdose. So when you do self-medication, someone is going to either get overdose or underdose. The effects of overdose, they are very many. Then another thing is we may have what we call masking the severe diseases. In masking the severe diseases, whereby I have the symptoms, like as we've given an example, I have headache, I have abdominal upset, I have fever. When I take a painkiller, these ones, they will disappear. But after 2 days, they will come back. Then I take also again the same painkiller. I'm doing self-medication. Then the 3rd day, at the end of the day, we are giving an opportunity for this disease to manifest. We are severely something. It's like sugar coating. You feel relief now. The most common example I can give is people have tooth problems. Someone has toothache, and indeed you need help. At the end of the day, this person gets a painkiller. In getting a painkiller, that person gets relief for that day, goes to the next day and the 3rd day. The effect of not going to a dentist, we are going to lose all the teeth. And you are going to hear a lot of stories. We hear them out there about the teeth, which is a very big topic and big story to discuss about. Now, at the end of the day, someone is going to lose all the teeth. So my advice is that in the due course of masking the severe diseases, it is better that we seek medical attention urgently. Bagamati omtitizi yawona. At the end of the day, because when you tend to be very strong, and you end up losing life.
And the president told us during COVID-19 that cowards live longer. Well, I know our time is almost out, but in a minute, what advice do you have to the people out there, especially when it comes to self-medication?
My advice to the people out there that self-medication is self-murder. Self-medication is self-murder in a sense that you are killing yourself unknowingly. It's like to tell someone that you go to a foreign land and you don't know what's there. It is at night someone tells you move from here to Koboko. We are amidst the war and someone tells you walk through. You don't know what is going to happen. Now, my advice is that each and every person out there, me and you, let us strictly adhere to treatment from a qualified medical personnel. And my urge also goes to the medical students. Self-medication is very common among the medical students. Very common. For your own information, that treatment that we are supposed to get is supposed to be from a qualified medical personnel. Students, what they usually do is that they are in the medical schools. They do self-medication. Yes, they are still undergoing training, but it is very important to get medication from a qualified medical personnel because someone is still undergoing treatment. Lastly, allow me also to include this, that self-medication has brought drug resistance. drug resistance, whereby someone is being treated with the same drugs and does not get the relief. But you treat them with another person, someone gets healed. It is very common among the infections, UTIs, recurrent UTIs, and so on and so forth. Someone tells you, I went to this hospital clinic here. Banziwa. Yes, they told me I would be like this and this. They gave me injections for 5 days, but there's no change. It could be that this person, there has been a misuse of the same drugs, more especially like the antibiotics. And the dosages this person is supposed to get, they are supposed to be higher. At the end of the day, it creates what you call drug resistance to the diseases.
Yes, thank you so much, Kato Hussein. It's been a pleasure, and because of the importance of this topic, I request you in the near future to find some time and come back, and we continue with our discussion of self-medication. But as of today, it has been nice having you tuned in. Stay blessed. Meet again next time.